Is it normal to have little leaks when you are pregnant? Does it mean there's a problem with your pelvic floor, and what can you do about it? It's Karen here. Hi there. I have got over 15 years experience teaching pre and postnatal Pilates. And one of the things I like to do is help women sort out their pelvic floor. But more than that, give women a chance to talk about it, because it can be one of those things that's a little bit embarrassing. It's a bit of a taboo, bit like periods. We don't like talking about it. So now's your chance. I've been doing this long enough. I've been a Pilates teacher for long enough to have heard all of it. So today it's really about the pelvic floor during pregnancy. And I have women in my classes and they talk to me and they're a bit concerned because they've had a little bit of leakage. They're feeling quite a lot of pressure down there. And the worry is that that's it. The pelvic floor is completely knackered and it's not going to be up to scratch, up to task. Here's the thing. Some of your pelvic floor muscles are involuntary. So it's like there's not really a great deal that you can do with those ones. So that's the first thing. And some women will be more reactive to the hormones in your body. So you've got all these hormones flying around your body during pregnancy. They do a really good job of helping give you some elasticity and stretch in your joints in order to get a baby out. But they affect everything in your body, from your blood vessels to your nasal passages to your pelvic floor and to those little involuntary muscles, your eyeballs even. They affect your eyeballs. I had to have a stronger prescription when I was pregnant because those muscles made my eyeballs made it harder to work. So the point is, don't fret too much if you are finding that suddenly, early days in your pregnancy, you're like, whoa, what was that about? Particularly if you're one of the unfortunate women who has morning sickness, be that minor, be that extreme, be that all day sickness. When you throw up, there's quite a lot of pressure. You might find you get a little leakage. So don't panic too much about that. That's kind of it's just your body, and you can't train your body, your pelvic floor muscles, for a heck of a lot of throwing up. It's not something that we ever think might happen to us. However, there are some things that you can do to help. Particularly thinking about the fact if there are involuntary muscles, there are some voluntary muscles. And unfortunately, the pelvic floor isn't something that, it doesn't attach to any bony parts. It's attached to a tendon. It's pretty big. And really the only way to get it stronger and more efficient at doing its job is for us to take a little bit of control and train it. So being active is important. If you carry extra weight, you're going to put more strain on it. If you sit down a lot in your job, so you're sat on your bottom, your pelvic floor doesn't really have to do anything, does it? So you want to just think about those things in terms of keeping it fit and strong and fit for purpose, so that it will help you push out a baby, but also it's going to go afterwards, which is what we want afterwards, just like that. So what can you do? Well, here are a few things. One is that you can just try and feel like, because during pregnancy, if the weight of bump pulls this forwards, pulls your pelvis forwards, it creates a lot more downwards pressure. So if you think about it, you've gone from here to kind of everything is pushing down on the bladder and on the pelvic floor, and you'll know what pressure is in your bladder during pregnancy. So one of the things I do in my antenatal classes is we think about the angle of your pelvis, and we just want to feel like, not that we tuck it under, but that you've got this more neutral position. So if you had a bucket, let me grab this jug here, looking for a prop. This is you pregnant. So if I fill this with some water here, this is you sitting nicely. During pregnancy, that tends to come to the front. What you want to do is bring it back again, so you've not got all that pressure on the front of the pelvis. So very simply, you're thinking about bringing those hips just a little closer up towards the ribs, so you've got that connection, and it's going to relieve a little bit of pressure on the pelvic floor. Longer term, there are things you can do, like strengthening your legs and your bottom and your thighs to keep you stronger. You can do some work to help lift and strengthen the pelvic floor. We do breathing work, so we've got the whole system of pelvic floor exercises that I do in my classes, and some of these I will pop it as a a little thing you can click on so you can get a bit more information on those. But the whole point of this is there are some things that you can't change or can't help. There are some things that you can. If you can work on the things that you can help longer term, being aware of your pelvic floor, being able to get some more control and some specific pelvic floor exercises, train your pelvic floor muscles like you would your bottom or like you would your arms, like you would your brain. It needs challenging, and there's no reason why you can't do that during pregnancy. And also we want to think about having bottom and thighs stronger to help support the pelvic floor. If you think about it, if you've got like a weak link in the chain, like that involuntary muscle in the middle, if you can strengthen the ones around the outside, you're going to do yourself a favor. And that's going to help you through the rest of your pregnancy and through labor and birth and postnatally starting to feel better again. So they are my things for today. What's normal, what's not? You want to think about those involuntary muscles, you know, that kind of explosive force of you throwing up or coughing or sneezing. Yeah, just listen to it rather than be completely panicked about it, because there are things that you can do. That you can work on the voluntary muscles, you can work on the pelvic floor, you can think about that little tilt of the pelvis, stay active, get the leg muscles and the thigh muscles working, and just have a better awareness of your core. Obviously, all of that stuff is brilliant. Pilates for pregnancy is brilliant for, but please, any questions, pop a comment in and I will see what I can do to help you out. But just, yeah, get in touch. Don't stress alone. Oh, and I should say, and again, I'll pop a link to the article on this. There are sometimes you might find you need to see a women's health physiotherapist. So I would always refer out if it was beyond my remit, and it's really important that you know that that is there for you too. See you later.